Hey guys, thanks for joining us at Preach It Girl. Today we're going to talk about traveling. Crystal noticed on our Facebook that we had a ton of questions about traveling, travel sonography, travel nursing, and I know just on the couple of Facebook groups that we're a part of, there's constantly new travelers and people saying, how do you decide? I have a ton of questions. So we thought we would address some of those here today. I think we'll have a couple more episodes on some of the topics that we can expand on, but we'll give you the rundown on how to decide if travel nursing's right for you.
Yeah, it's a great world, and I'm very happy that I did it. If you have any inkling or drive in your heart to do it, I will say go after it. The jobs will be there when you get back. I know the biggest fear is like not having something to come back to, but if there were ever a time right now, there's going to be a job to get back to. So go for it. And I don't regret anything about traveling. Do you? Is there anything you would trade?
Oh my gosh, it was the best adventure I've ever been on, and I'm not sure that I'm done traveling. I'm taking a hiatus right now, but traveling, regardless of the money, is such a fun, wonderful way to see the country and learn about the career that we work in. Like, it's really great kind of getting to go to different hospitals and explore and adventure and learn new things and just expand your horizons. Crystal, how did you decide to go travel? What was that call? How did you answer that?
I think I knew in school I wanted to travel. So in school, I was like calling recruiters, trying to figure it out. They were like, you need experience. So I just made sure I got experience the first couple of years. And then as soon as I could, I called and went. My very first assignment was in the Virgin Islands.
No way.
Yeah, it was fun. But I ended up not being there very long. I got there and there was no place for me to live. There was like no place to rent. So I was
That's
like
the
staying
traveler's
with someone.
worst nightmare.
I know. I didn't know. And it was an adventure. But even then, even when the first assignment didn't go well, I knew that it was still something I wanted to do. Even 2 weeks in the Virgin Islands was enough for me. So I came back and went to Texas and it worked out really well. It's a really great experience. And one of the things about traveling that I think is so good is like you get a recruiter and you have that support system, and it's like the best feeling. Like you're having a bad day, you have someone to talk to. You need help with your contract, you have someone to talk to. You know, things aren't going like you plan, you have someone to talk to. The biggest change for me, other than finances, when I settled in at a permanent job, was not having my recruiter.
Not having that person to go to and reach out to. Yeah, I agree. My recruiters have been kind of a best friend, a phone best friend over the years. So it's really important to find a recruiter that you like. We're kind of jumping into that so quick, but let's talk about finding a recruiter that you like. You're going to get a ton of calls from recruiters. You're probably getting them now. And you're like, where do I even start? Literally just find someone that you enjoy talking to, that you feel listens to your concerns and answers your question. Every recruiter is a little bit different. Some are really big salespeople and they just want to get you the biggest, baddest contract. And some recruiters are like, nah, I'm your friend. We're just hanging out, like tell me what you need. So depending on the kind of person you are and the kind of support you're going to need through traveling is going to depend on your recruiter. And I think it's really important to just find someone that you're comfortable with, who you're comfortable talking on the phone with, because you spend a ton of time talking to your recruiter. And so if you don't like them, every interaction you're just going to be annoyed with. But I know my first recruiter, Tanya, I loved her. I worked with her for 6 years, and just being on the phone with her when she would call, it was just the best time ever. It was like, oh, Tanya's calling me. I get to catch up. So I think finding a recruiter is really important.
Yeah, it is. I think that for me, an important factor was they texted me jobs. So I didn't have to constantly be reaching out or going after the jobs for myself. I would say, hey, I'm interested in this location. They would send a text and then I'm like, all right, let's call and talk about it. Or no, this job doesn't work for me. So yeah, like she said, you're going to talk to them a lot. You're going to really get to know them. And so finding someone that you jive well with and that you trust and that you know is there for your benefit more than just their income, because you kind of rely on each other for an income. So having someone who is your teammate is really important.
Yeah. I think before we even get there, we need to talk about, how do you figure out if traveling is right for you? And I think that when we kind of went traveling, it was this call to adventure, this call to excitement. And now it's a call for money. Can I get paid what I'm worth? Where can I go to help out staffing? Those kind of things. And so I think a really good place, if you're like, do I travel? Do I not travel? Discover the reasons why you want to travel. Do you want to travel for money? Because that's out there right now. But if the way healthcare is going has initiated some kind of drive in you to like go for the adventure, you have so many options. So I think you need to decide kind of which reason you're traveling for first, and that'll direct you to kind of which company, and then from there, which recruiter that you're going to work with. Did you travel for money? Did you travel for adventure? How many high-paying contracts did you take? How do you feel about money coming out of travel nursing or travel sonography?
I do think that for me, I wasn't money focused. Of course, I wanted to make enough money to like get by, but it wasn't the key of why I was doing it. I wanted to be in cool, exciting areas that I could roam around. So I wanted to go to like Maine in the summer or, Arizona in the winter.
Yeah.
How I ended up here. So for me, I had a lot to do with that and my family, where they were. I wanted to be in locations they were. Or like if there was a 7 on, 7 off, I was taking it. Even if the money was less, I was like, man, I want the 7 on, 7 off job. So it was just for me, whatever was better for quality of life, because you don't have the financial stresses as a traveler. Like you have your rent and stuff back home, but the rent that you have on traveling, is for 13 weeks. Like you know what's coming. And a lot of that is taken care of. You get your per diems. You're getting a food allowance every day. So it's really less stressful.
It is. When you start thinking about your life in 3-month increments, it seems very manageable to like do so many things then. When you think like, oh, am I going to have that much money or that much time by the end of the year? 12 months out is such a long time. But when you're thinking 3 months, what can I get done in 3 months on this amount of money? You're like, oh, right, we can go to the Grand Canyon or a 6-hour drive to go see Yellowstone. It suddenly becomes worth it when you're 2,500 miles away from home. And so taking a schedule that's 7 on and 7 off guarantees you that you have a week off every week and gives you that time to go adventure. And I think that's a big reason why people leave to go travel. I know that was a huge one for me. My first assignment, actually, this is so funny, especially now with the way things are. My first assignment, I was making less on contract than I was as a staff nurse. When I got to Indiana, my mentor actually kind of discovered that I was getting paid $11 less an hour than the other travelers that were there on crisis, and helped me to negotiate and speak up for myself. But I wanted to travel so bad that I was willing to take a pay cut. And I did at first, but then once I got there, luckily they were like, no. Your traveler or your recruiter didn't really give you all the information. And then I was able to get that bump up in pay and get on with some fun adventures. But I think for the most part, I traveled like you, just to put me in someplace random. Let's go see what happens.
Yeah.
I think that's just such the fun of traveling, is you just get to kind of throw a dart at the map and see where you land.
Yeah, it's awesome.
So we talked about finding a recruiter, but I think which we can lead right into this, is finding a recruiter versus a location. So are you looking to travel for money, or are you looking to get to a certain destination? Some people know they're not going to travel very long, and I just want to get to Hawaii and I want to get to Alaska, and whatever gets me there, gets me there. And I'll tell you that you're not going to get paid much in Hawaii because everyone wants to go there. So there's a lot of competition, which means they don't have to pay you well. But going there is an incredible experience. Now, if you want to go to Connecticut in March, that's a high-paying contract because nobody wants to go there, and the snow's insane and the winter's dreary and those kind of things. So if you're trying to get to a destination, you've got to figure out kind of where do I want to go. But if you want to travel just for the adventure, then you can just find the recruiter or the agency that you want to work with.
Definitely. And like if you want to be near family, or you're moving and want to take a travel assignment, like where you're moving to get familiar with the location, it may be better to take one that's got less work hours and better quality of life than to take one that you're working 5 or 6 days a week. So
I've encouraged so many nurses over the years whose husbands or significant others were relocated for work to go and take a travel assignment. Don't go sign on to a hospital first. Go take a travel assignment there. First of all, make the little bit of extra cash while you can, but figure out if you like it, because you can always go take a travel assignment at another local hospital to see if you like it too. So if there are travel openings in a destination that you are being relocated to, I say go that route first. See if you like it. 3 months you can do, and it'll tell you a lot about a hospital. Yeah. So I know we were talking about, once you get your recruiter, that's what we were talking about, getting the recruiter and asking the right questions. What do you want to know once you've decided to travel, once you've decided where you're going, and you've got your recruiter that you really like? Now, what do you want to know? You don't need to know about benefits necessarily, because there really aren't many, and you're going to know what the company's offering right up front before you get your contract. But some questions to ask when you're put in contact with that hospital would be about floating, staffing ratios, uniforms, work expectations, time that you want off, hospital policies. What kind of other questions did you ask in your interviews or discuss with your recruiter before getting to assignments?
How often they had travelers was important for me, because that kind of let me know a little bit about the department. And I also wanted to know their daily patient numbers, what type of exams they did most of the day, if there was a designated person for the ER, because in ultrasound, you're kind of all over the hospital. So if there's a person that's in the ER, it's definitely less stressful when you're at a large hospital, or if you get to be that person in the ER. So just little questions like that would work. Some small town hospitals want you to be able to do echo. So I just would make sure, if they did or didn't, or just like little questions like that, or how their radiologist was, if they were nice.
Yeah.
That's always a key.
That's always such a big one.
Yeah.
You just roll the dice with that. Yeah. I know asking about travelers is a big thing for me. I want to know how many travelers a hospital needs. If you're applying for a job and the hospital needs 30 travelers, they have a problem retaining staff, which means that work environment is probably pretty rough. If you're going to a large hospital that has 7 different ICUs and they only need 5 ICU nurses, that's probably a pretty good gig and you're going to want in on it. So learning contracts and learning to ask, why don't you have staff? Where are your staff? Sometimes you're filling in because everyone got pregnant at the same time and everyone is on maternity leave. And then you go in and it's a great job and everyone's in a great mood and you're just filling in for this group of women that are all out and there's just a couple of you travelers. And some places just use travelers continuously. I know Tucson always has travelers, and not because it's not a desirable place to work, it's just our rotating population kind of always has a need for people coming in and nurses to be here at different times of the year. So pretty much most of the year we use travelers. I would say we die down a little bit in the summer, but finding places, also seasonal is like, you can travel seasonally and really follow the weather to get to good places. I know for me, like you, I always wanted to be where it was sunny in the winter and warm and just rub it into everybody. What kind of other questions do you think are important to ask?
I think licensing. So for ultrasound, there's only like 2 states or maybe 3 that I know of, North Dakota, New Hampshire, and New Mexico. Actually maybe 4, maybe Oregon, that you have to have an ultrasound license. But other than that, everywhere else, our registry is national. So
nice.
It's pretty easy if you're registered as a sonographer to go somewhere and get anything. If you're vascular registered and you just do vascular, I would definitely advise trying to get education in echo. It will definitely help you open up more jobs. But there are a lot of vascular jobs as well. So the more registries you have, the more likely you are going to find a job. And a lot of bigger hospitals want more than 1 registry. So it's always good to get your licensing together, your registries together, and just get as much as you can now before you go into traveling, as much information and knowledge. So when you get out there and you're faced with something that you know kind of how to tackle it.
Yeah, absolutely. It's funny how different sonography traveling is from nursing, because nursing, we're just licensed per state. Arizona is a compact state. So Arizona, along with 21 other states, as long as you're licensed in one of those states, you're able to work in any of those 21 states as a nurse. Now, I'm from Pennsylvania, a weird commonwealth, and they have the most bizarre laws out there. And so Pennsylvania is not part of the compact state. So anyone that wants to work there has to apply for a license through that state. It's done just kind of by applying and showing that you have a license in another state. The biggest thing is sending in fingerprint cards, which is really annoying, and just waiting. So if you know you want to go to a destination, see if you have a compact license and see if your license works in that state. And also to kind of get that ball rolling on getting a license started. I know California can take like 14 to 16 weeks. The pandemic, they were pushing people through and just kind of doing kind of honorary licensing, but I'm pretty sure they've slowed down with that now. And Louisiana took me 10 weeks to get a license, so much so that I missed the contract there and didn't get to go for Mardi Gras. But that's probably a blessing. At the time, I did not need to be in Mardi Gras for Mardi Gras, or in Louisiana for Mardi Gras. But, those things are something to keep in mind, that if you really have a date that you want to start traveling by, that you need to get that ball rolling on your license if it's going to be something you have to apply for out of state. Some other questions that I like to ask when I'm talking to a manager are, what are your patient ratios and how often do you go over that? As an ICU nurse, I don't want to be tripled on a regular basis. I know that that's outside of my ability to care for my patients, and that will make for a very unhappy work environment for me. So I do ask about staffing ratios, and I do ask about floating. And I ask, where are you expecting me to float to? As an ICU nurse, I understand going to a step down. Sometimes I can even understand going to telemetry if it's not too many patients. But sometimes if they want to send me to the ER or behavioral health, somewhere where I don't have a lot of experience, I want to discuss that with a manager up front. Do you expect me to go to these places that I don't have experience with, or is there a little bit of wiggle room? It's really important to know. Travelers get really confident in their contracts and think that just because they put something in a contract that the hospital holds true. I've seen hospitals cancel so many contracts because on the day of, the nurse decides not to float and they realize they don't need you that much. And so just ask the questions that you know are going to be hard stops for you, because if you're someone that doesn't want to float, ask right away, is that something they do a lot? If they do it a lot, don't go to that hospital. If the manager says you're only floating maybe once or twice while you're here, that's manageable and realistic. So I think find out what you like and dislike about nursing so you can ask those target questions when you have that brief window of time with the manager.
Definitely be able to stand up for yourself too. We had this conversation at a coffee shop one day and she told me about that and I was like, wait, your contract says that? And then they cancel you? I'm like, somebody needs to rewrite these contracts. Because in more of my realm of traveling, be flexible if you're a traveler. Like, you're going in, you are helping people, and they are so relieved to have you there. And when you're flexible, it's going to make them kinder to you, and you're going to be able to give a service, which is why you are there in the first place. But also understand that if there is something that you are adamant about and you put it in a contract, if you communicate that in your interview and they agree to it, and then they try to backfire later, talk to your recruiter, talk to someone about that. That's not fair.
Yeah.
And we're humans, and they're written contracts and signed. So both parties signed.
Yeah,
and they
absolutely.
should stand by what they say.
Yeah, I think in the experience that I've noticed is hospitals aren't open to altering their contracts, but recruiters will alter it for you to get you into the job, only to find out that the hospital doesn't honor that newly written contract. And so it kind of goes through a lot of hands, and it's very like by the book. And so I think that little changes like that don't get honored because it's like, no, that's not what we do. It's unfortunate, but just be very clear about things that you want, and make sure if you want time off or if you do not want to float, make sure it is in writing somewhere. If the hospital decides to cancel your contract because you stood up for yourself, then that's a whole different issue. But I would definitely get those kind of things in writing. Or if you're like, every Sunday, I don't want to work and I've talked to the manager and it's okay, make sure that's in writing so you see it somewhere.
Or if you're, for like ultrasound, if we're signing a contract for 312s on a day, they can't just put us 5/8s at night.
Yeah, exactly.
You gotta, they'll try.
Don't you worry. They try to change contracts all the time.
And if you don't mind, some hospitals 5/8 at night is like the best place you can be for ultrasound. I'm not gonna lie, but you just have to decide that first and know that you do have a little bit of power, and hopefully, like she's saying, like, make sure you do communicate it in your interview, because the hospital may not even know that, the contract was changed on your end. So
yeah. And as an ICU traveler, I always kind of ask, like, what kind of patients do you have? Am I getting more of surgical ICU? Is this medical ICU? Do you even have intubated patients? Are all of your patients intubated? I kind of want to know what I'm walking into, because a small ICU hospital where I'm given 4 patients that are all walkie-talkies is going to stress me out. But also going into a neuro ICU where everyone is strokes, I know that's not my big comfort zone. So for me, it's a little bit more discerning, because usually I'm working cardiovascular and they like to ask, they want to know that I'm ready to go into a cardiovascular ICU. But I think if you're traveling tele or med surg or even ICU, like, ask about your patient population. It's going to be different than where you're at. You would be surprised, even though hospitals are so similar across the board, how much different patient populations can vary and how much that changes the capacity of your job. So ask those questions. It's really important.
Yeah, for sure.
Crystal and I have decided that we're going to do a whole separate broadcast on pay and housing, because it's just so in depth. But know that it's a complex kind of decision-making area. Like, you have to really sit down and think about what you're willing to make, where you're willing to live, and how much you're willing to pay. That travel nurses and travel healthcare workers make so much money. We make decent money, but you really have to be good with your money. And, sometimes you're paying a lot up front before you even get to a city, and you're not going to see a paycheck for a couple months. And so you have to be really smart about balancing your money or taking housing, or know what kind of housing to take. I'll let you touch on that, but we're definitely going to do an episode just on pay and housing so we can answer all your questions.
Definitely. I think for me, I always checked for housing before I took the contract. I didn't sign anything until I just did a quick search to see if there was stuff out there. And I also, for as far as benefits and stuff, if you need benefits and a company's offering them, and maybe that pay package doesn't look as well as another one, but then you're getting benefits and 401k matching and like stuff like that.
Or dental for a couple months.
Consideration, because that's still coming out of the pocket of the employer. So you have to figure out what's the most important for you, and then go with that. So just ask those little questions about what all you're going to be getting, and look for housing before you take a place, and then can't get there because there's nowhere to live.
And if you're going to take housing from the company, it's really important when they say furnished, figure out if it's furnished with kitchen stuff and towels and bedding, or just furnished with actual furniture that you need to buy sheets for and buy a shower curtain for, because that really changes things. And if they're housing you, it should be fully furnished. It really should have utensils and cups and plates. The idea of a furnished apartment is that it offers all those amenities. So when you're talking to your recruiter, and if you're going to take their housing, make sure that those questions are answered for you, because that's really important. It's tough to get 2,500 miles across the country like my little sister did and realize that she had nothing with her and just furniture in an apartment. So it was a stressful couple weeks for her before she was able to settle in and get things right with her company. So I think that's a really, really important thing. But like I said, pay and housing, whole different episode. So stay tuned for that one.
And let us know what you guys want to know about it. Like what your specific questions are, like what you think your bottom line for pay is, like the lowest you're willing to take, or, just let us know also what you want to know about that.
Yeah. Something really fun is that Crystal and I are both getting into recruiting. So we are going to be here to answer all your questions, help you guys, just kind of give you the back end side of things and help you make a decision that's right for you. Yeah. And when you decide to travel, the best part is deciding to go on the adventure.
Yeah. And even if you don't use us, we're still here.
Yeah.
So,
absolutely.
I've worked with a ton of recruiters. I know you have. I've had situations where I was told I could bring an animal, brought the animal, had to find housing for the animal, got there, couldn't have.
Poor sunshine.
Crazy different things. But so we get it from that end, and now we're going to learn the other end of it for you guys. So we just, any way we can help. But yeah, we're excited. I'm excited to be a recruiter. I'm
so excited.
Support from that end of it, and like help people find housing and make sure they're getting cared for well.
Yeah.
So,
and I want to root for my nurses. I want to be that person you're calling at 8 a.m. when you got off a night shift, and I want you to know that your story about your worst night, like I totally relate to. So we just want to give you kind of all the behind the scenes for recruiting and be a support for you guys. So,
yeah, we have your back.
Yeah. Well, thanks for joining us for today's episode of Preach It Girl. Remember that we're on Facebook at Preach It Girl. You can just find us there. We have an email, so email us any questions you have. If you want topics, or if you're like, hey, when are those support groups that we're talking about on our Facebook? Email us. It's preachitgirl, all one word, @mail.com. We've got a Twitter, Preach It Girl. I have Instagram, RodeoWish_RN. What else are we missing? Is that everything?
Yeah, that's all that I can think about.
That's enough to keep track of. But you are able to reach us. Let us know what you want to hear about. Let us know what you need. Our cups are both filling up so that we can help support our frontline workers. So we're here for you guys. Yeah. We're going to close. I'm going to do a brief little meditation about maybe figuring out if traveling is right for you. But if you're done for the day, peace out. Thanks for joining us. Otherwise, hang tight. We'll just get comfy.
And we'll put some resources
below. Absolutely.
Just different Facebook pages for housing, nursing pages, ultrasound pages, just different pages for you guys that helped us in our journey. Absolutely. So we want to be able to help you. And so that'll be below.
And connect everyone together. So like and subscribe. That's what we need. We need love. If you're like, oh, you guys are fun, we like you, we need love. So like, love, and tell your friends about us, and tell your friends to email us questions. We just want to get it out there. And if we don't have the answers, we're going to find you guys someone who does.
We are. And even like if you guys want therapy or coaching or need resources and you don't know how to go about them,
Tell us.
We'll be here. We'll help you find it. Like,
let us be
if
your
we don't
virtual
know
assistants.
someone, we'll find someone who knows it. Yeah, because
Yeah.
we want to help you find the support that you need. And we want to be able to give you that resource to help find it.
Yeah. All right, let's snuggle in for a little meditation. Get comfy. Whew, close your eyes. Roll your shoulders. Wiggle your hips. All right. So we just talked about traveling. Is traveling right for you? Think about that for a minute. If you could go anywhere, where would you go? Let your mind wander. Sunny places, snow places, rainy places. Do you want to go see New York City, San Francisco, San Antonio, maybe South Hills, maybe South Dakota, Arizona? Does some place spark joy in you? Or are you feeling the call to travel to support your other frontline workers? That's good too. Are you ready to get paid the money that you deserve? Maybe go work for a few months and take a few months off. That's okay. Acknowledge that feeling inside of you. And just say that's okay. You don't have to make a decision right now, but sit with it. And let yourself know that it's okay to change up your situation. It's okay to go to a different hospital. It's okay to change your life. It's okay to go on an adventure. So just sit and take a couple deep breaths. You'll know if adventure is calling you. Now make a little wish in your heart of what you've decided. You don't have to decide that you're going to travel, but decide that you're going to not know, or decide that you're going to think about destinations. Decide that you're going to look into recruiters. Decide that you're really happy where you're at and you're just going to be a little bit nicer to the travelers that are coming on. Whenever you decide, just sit with that decision for a moment. And smile and hug yourself. You're out there saving lives. You're making a difference. We're sending you love and energy and support. Everyone loves you. We're going to give you strength. We're going to give you options. We're going to give you resources. Until then, hang in there. Take a nice deep breath. Flutter open your eyes. And go get it, girl. Preach it.
Preach it.
All right. Thanks, guys.
Bye.
Bye.